Hi everyone, welcome to another health talk series. And today we'll be talking about something that is super important. And this topic was actually suggested by I think two of my listeners last week, or I think the week we talked about high blood pressure. And this topic that was suggested is known as low blood pressure, also known as hypertension. Um, Please feel free to suggest more topics. Thank you for those that suggested this particular one. So let's go down to our topic for today, which is actually low blood pressure. So, what is low blood pressure? What is which is also known as hypotension? Hypotension simply means when your blood pressure is low. The average blood pressure is meant to be 120 over 80 millimeter mercury, and most times the doctors prefer your blood pressure not to get higher than 140 to 90 millimeter mercury. But once your blood pressure gets to as low as 90 over 60, it is considered to be too low. That's what it's a sign of low blood pressure. So what causes this low blood pressure? What are the things that causes low blood pressure? One of the first causes of this low blood pressure is dehydration. When you don't drink sufficient water, your body becomes dehydrated and it can lead to reduced blood volume, and that can also lead to low blood pressure. The second cause is blood loss. So people that have injuries that lead to loss of a lot of blood, or for ladies that have high menstrual blood flow, it can lead to a lot of loss of blood in that time of your month, and this can also lead to blood loss, or even women during childbirth that lose a lot of blood. So anything that causes a lot of blood loss, it drops the volume of your blood, and it can also lead to low blood pressure. Then the third cause of low blood pressure is actually nutritional deficiency. So when you have lack of vitamins such as your B12 and your folic acid, and this can lead to anemia. That these vitamins are necessary for your build-up of your blood, and once you are sufficient deficient of these nutrients, it can lead to anemia, which also leads to blood volume loss, that's depletion, and this can lead to low blood pressure. The third and the fourth one is actually people that have some heart conditions such as heart failure, people that have slow hearts. This can lead to low blood pressure. The fifth one is endocrine disorder. So people that have issues with their thyroid, those thyroid problems can affect your blood pressure, and it can lead to this low blood pressure we are talking about. Then we have people that are on certain medications for blood pressure itself, medications for depression, medications for Parkinson's disease. So sometimes your blood pressure can be as a result of the medication you are on. But please do not stop any medication you are on. You need to see your doctor. So once I talk about some signs and symptoms, once you're experiencing any of these signs or symptoms, please ensure you see your doctor that placed you on that medication, and your doctor will evaluate the risk and the benefit and decide if they need to change you on that medication or still maintain you. Then also, I think the last cause that we're going to be talking about today could be when you stand up too quickly. So, when you are lying down, especially those that once you wake up from sleep in the morning and you just get up abruptly, that's fast getting up can lead to what is called orthostatic hypotension. That means there will be a sudden drop of blood pressure as a result of just standing up appropriately, and this can lead to low blood pressure. So what are the symptoms you may experience to know that, okay, I may be experiencing low blood pressure? Note that not everyone will experience symptoms. When it comes to signs and symptoms, everybody doesn't experience all this. Some will experience some may not even have any symptom at all. But just a general guideline would be dizziness. You feel dizzy, you feel light-headed. People that feel weak, you feel like fainting, blurry vision, nausea, you feel like throwing up, you feel fatigue, overwhelming weakness, cold. These are some of the symptoms you may have that may be a pointer that you may be experiencing low blood pressure. But please, if once you experience such symptoms, as I said, you have to see your doctor, because this is not what you manage on your own, because a sudden drop of blood pressure can lead to shock, and which is a medical emergency. I know the essence of these health talks is to ensure we prevent such a thing. So what can we do? Prevention, because my target is prevention, prevention, prevention. So how can you prevent this low blood pressure? How can you manage your low blood pressure? Number one is to ensure you stay hydrated. Drink a lot of water, especially if you're in a region that has that is very hot, or you're in an environment that is very hot. Ensure you drink water to stay hydrated. Those that exercise, when you're exercising, go with water, so that once you're exercising, at intervals, at breaks, you take sufficient water to keep yourself hydrated. Ensure you eat a balanced diet. Your diet should contain enough B12 vitamin, enough iron, so that your blood volume will be healthy. Those that do not stand for too long, because when you stand for too long, if you have low blood pressure, you may feel dizzy. And please, when we are standing up, don't just stand up appropriately. If you are lying down, it's advisable that you turn to your left hand side, and you gradually lie down, stand up. So let's don't just wake up, especially in the morning. Let's not just stand up appropriately. Those that have low blood pressure, if your doctor has diagnosed you with low blood pressure, ensure you wear what is known as compression stockings. If you're on medications and the medications make you feel dizzy, ensure you see your doctor and talk it out with your doctor. Then it is known that when you eat a lot of food at a go, your blood goes to your blood pulls at your stomach to digest your meal. So, and that can also lead to low blood pressure. So it's advisable that as we are getting older, we eat our meals in small quantity. And if you feel faint, see your doctor. Once you feel you are weak, you're pale, difficulty in breathing, ensure you see your doctor. Know that low blood pressure is not always dangerous, but when it causes symptoms, it needs attention. Stay hydrated, eat well, listen to your body, and if you're unsure, check your blood pressure. Thank you very much for listening. And as usual, if you find this video and these messages necessary and important, and you love it, please help me share to your loved ones, so that we can spread the message to ensure we are safe. And as usual, I'm open for more topics that you're interested in me talking about. Thank you very much for listening. Bye.